In a bold call for stronger regional collaboration, Dr. Ouma Oluga, Principal Secretary for Medical Services in Kenya's Ministry of Health, recently emphasized the importance of integrating health packages across African nations. His remarks highlight a pressing need for a more unified health system on the continent, one that can drive greater access to care and improve overall public health outcomes. Speaking to AMN Plus, Dr. Ouma pointed out that despite significant strides made in healthcare reform across Africa, many countries still face challenges such as inequitable access to medical services, underfunded healthcare infrastructures, and fragmented health systems that hinder the effectiveness of national health programs.
The African Union has already laid a framework through what we call the Agenda 2063. And the Agenda 2063 lays a lot of emphasis on the well-being of African citizens. But well-being cannot be achieved without peace, without people living in harmony, people acting together, people looking at the same vision. And what is that vision? That vision is for all of us to invest together. Many of the African countries, because of the changing architecture of financing healthcare systems, must work together so that programs benefit the entire continent rather than just one country. As many of our populations are individually, it is much stronger to present one united economic front at the international community so that we are a strong people that can coalesce all of our resources to build the centers that we need for healthcare, centers for treatment.
The Kenyan health leader urged African countries to take a more collaborative approach by pooling resources, sharing knowledge, and integrating health services across borders. According to Dr. Ouma, the integration of health packages will not only help in addressing distinct disparities but also facilitate faster response times to health emergencies such as disease outbreaks that often affect multiple countries simultaneously.
But also invest more in issues of trade, in issues of alleviating poverty, issues of education, so that every single citizen in Africa may have know-how to move their own lives, may have dignity of knowledge, dignity to plan their families, dignity to plan for themselves, dignity to have a healthy access to livelihoods. And this is important for education. It is important for economies to thrive through breaking the barriers of trade so that goods can flow from one country to another. People can flow from one country to another, exchanging ideas, supporting each other, building up together. And more importantly, of course, that we respect the human dignity, that we respect the shared responsibility of every person having the space to access care, access health care as a right, and access this care as a human right, not just a right. And so these are values that I personally, Dr. Ouma Oluga, uphold to, and I'm glad that within this building of the Africa Union Commission, these are the values that are being worked on every single day. But more importantly is that every single continent, every single government official like ourselves make a commitment to move towards this space.
Dr. Ouma also highlighted the importance of leveraging partnerships with global health organizations such as the World Health Organization and the African Union. He called for increased investment in healthcare infrastructure and personnel training to ensure that the health integration goals are met. In conclusion, Dr. Oyuma's remarks signal a turning point in Africa's health discourse. His call for the integration of health packages and cross-border healthcare cooperation echoes the broader vision of a united Africa, where health equity and accessibility are not only aspirational but attainable goals. As African countries continue to navigate the complexities of public health, the idea of integration presents both a challenge and an opportunity for transformative change on the continent.